Hi, I'm Derek Guillory. I'm the founder of Root Causes Medicine, and I'm so glad you found this video. I am providing an introduction to the practice here, to what we do, so that you can decide, is this root causes medicine stuff for me? So, as an introduction, I have a broad base of patients. I am an emergency physician, boarded in emergency medicine, conventionally trained as an MD, and I found my way to root causes medicine because of my own journey as a patient. I'm not an oncologist. I'm not a neurologist. I'm not a pediatrician. But I see many different types of patients, and it is my belief, you might call it a religious conviction, that the causes of disease are the same, whether it's a child that's struggling with asthma or eczema, or a teenager or a young adult who's struggling with thyroid disease, or an adult with cancer or neurodegenerative disease. The underlying causes of those conditions are the same, and the difference is the unique individual and the timing. So for this introduction, I want to go through the two priorities that every patient has here and the two causes of all disease. So two priorities: symptoms and causes. Every condition we have to consider symptoms. They're really important. Really good example is back pain. If you have back pain, I want to treat your pain. I want to help you get out of pain. But then I want to think about why you have pain. The same is true of cancer. The curious thing is that tumors are symptoms. So in conventional medicine, we're often preoccupied with symptom treatment only. So tumors are really important to treat. You can't ignore them, and we must do something about tumors right now. But that ignores the other half of the priorities, which is causes. So in all conditions, whether it's pain, asthma, acne, or dementia, we have to deal with symptoms and causes. Okay? So, two causes for all disease. This may sound very unusual. It is my belief, it is my experience that has proven over the last many years that there are only two causes for all disease, and that's deficiency and toxicity. So deficiency is that word that describes everything your body needs that it doesn't have, and toxicity is everything you have that you do not need. So all I do most days with respect to cause analysis and treatment is try to figure out what I need to replace and what I need to remove. Now those are the biggest categories. It's the most simplified I can make chronic, complex, debilitating illness. Right underneath those two categories, deficiency and toxicity, are genetic and environment. So there's genetic deficiency and genetic toxicity, and there's environmental deficiency and environmental toxicity. So this is the way I think about patients. Whether it's a child with eczema that has severe immune dysregulation created by vitamin A deficiency, vitamin D deficiency, created by inflammatory toxicity. So inflammation in the gut, the center of the immune system, and on the skin it's a toxicity, it's an inflammation that's in excess. Or whether it's a patient with cancer that also has immune dysregulation created by severe vitamin A deficiency, severe vitamin D deficiency often, and inflammatory toxicity from all sorts of causes, and metabolic toxicity, where they have high sugar, high insulin, high IGF-1. These are the underlying causes of these conditions. And while symptoms are really important, we have to deal with them. We also have to deal with causes. So you can't ignore either one. That's the really basic understanding of how I think about patients. 2 priorities, symptoms and causes. 2 causes for all disease, deficiency and toxicity. This paradigm, this framework, is how I think about patients and illness and health and vitality. The really neat thing is that this empowers you, because you and I together, or even just after watching some of these videos that we're going to be posting, you have incredible power to take control of your own health by considering, what do I need more of and what do I need less of? So every minute of every day, you're just considering and working out the underlying causes of disease, which can lead to healing, or at least a lot better. Thanks for watching.